Hello, everyone. Good afternoon. Hope you all are having a good day. So thank you all for coming to our second public health advocacy course, our program. So let's go ahead and start. I'm probably gonna just wait probably two or 3 more minutes just so everyone who wants to come can come. Um, but yeah, if you have any questions or if you still need to submit the thing from last week, you can feel free to do that right now. So everyone can see my screen right now, right? Okay, cool. Awesome. Also, if you have any questions, if you're new to this class or new to Kid Teach Kid, you can either ask in the chat or you can ask in the Q&A. I would probably prefer the Q&A because I can see your questions better, but you can ask in the chat as well. I'll try to get to your questions as soon as possible. So yeah. All right, so now let's go ahead and start. So yeah, welcome to our second public health advocacy program lesson. If you weren't here last time, I just wanted to say that this is more of a self-based, self-focused sort of program where you could get to be more interactive and do your own thing instead of me lecturing the whole time. I hope you guys had fun with the project or the mini project that was assigned last week. So thank you all for those of you who turned it in. They looked great. So this week, as we can see here, we're going to be talking about actually how to take action and make a change in your communities. And specifically, we're going to be doing that through teacher outreach, which is the first step in doing advocacy work for education. So let's keep going. For new members, for those of you guys who weren't here last time, first thing you have to do is join the Google Classroom with the code WX46HN. Let me go ahead and write that down. It's WX46HN4. Okay, so use that code to join our Google Classroom if you haven't already. If you want, please watch the first half of last week's recording. It'll tell you all about what this program is about, what we're trying to do, what your tasks are, what our ultimate goals are, and just give you more of an insight into what's going on around here. So I prefer that you do that. It's posted on Google Classroom, and you can also find it on the Kid Teach Kid website. So another thing that you can do is explore the projectunmasked.org and other Kid Teach Kid programs. We have a bunch of other classes here this summer. So a lot of other activities too. We have some great initiatives coming up, like a conference, and feel free to recommend it to your other friends as well. So those are the three main things that I wanted you to do if you are new here. Okay, so let's recap a little bit about what was happening last week. So first, last week, I explained the importance of public health literacy, and just a recap, it's so that during outbreaks or during times that are abnormal, we want to have a populace that is well versed in public health and epidemiology, or a population that has high levels of public health literacy. And we want that, and to do that, we will use public health education methods. So we have using teachers, using our school boards, using different lawmakers and things like that. So we'll use all of the resources available in our society in order to make change in our education systems to better emphasize public health and epidemiology. So that's like a recap of what public health literacy is and why it's important. Okay, the next thing that happened last week was I assigned a project that you maybe submitted before class today, but if you didn't, don't fret it. It's kind of just make sure that you at least know the concepts. For those of you guys who did, thank you so much. This is a very great example of one that was submitted on the right. So we have, like, for polio, we have the chain of infection, all the important things. It looks amazing. So next you had to complete the Google form that was available on the Google Classroom. Basically, it just talks a little bit about what your experiences were working on this and whether you would like me to improve some things in the future. So it just helps me get to know what your preferences are. So those are like the three main things that was supposed to happen last week. Yeah, if you didn't do the project or if you're not done, please get it in as soon as you can. or if you have any questions, I'm always available to answer your questions. Okay, so this week our focus is on teacher outreach. So currently, public health and epidemiology are not taught in schools, or not taught in most schools. I don't want to just put a blanket and say they're not taught in any school, but in most schools, it's not part of the required curricula. So for example, in your biology class or your health class, I'm sure you learned a lot about like bacteria and viruses, and you probably learned about like the human body and like medicine and treatments and things like that, which are great. They're very important topics. But one thing that's missing that also accounts for part of this equation is the emphasis on public health and epidemiology. So what I mean by public health and epidemiology is focusing on the dynamics of diseases in a population. So what does that mean? It means how are diseases spread? How can you get a disease? How can you prevent yourself from getting a disease? How can you educate others on diseases? And how can we overall overcome outbreaks and epidemics and even pandemics? So topics like those aren't really emphasized. And by more specific means, I'm talking about things like the reproductive ratio, herd immunity, modes of transmission, chain of infection, basically all the things that were required in this mini project. So things like symptoms, chain of infection, prevention measures, treatment measures, and all the case definitions, things like that. A lot of them are foreign concepts. And so that's why I find it really important for you guys to actually work on the mini project, because then you can actually familiarize yourself with what you want teachers to be teaching. Okay, so what is teacher outreach? Contact teachers in your school/district to ask them to teach public health and epidemiology. So what this means is you would basically ask your teachers, is this part of our curriculum? Is public health and epidemiology part of our curriculum? And if not, would you be open to teaching this for students? And then you would just talk about all the different important reasons why teachers ought to be teaching this to their students. So things like helping to prevent misinformation spread, educating a population about more educating a population about things that go beyond the individual, making sure that students learn the importance of taking care of themselves in a pandemic to prevent other people from catching disease, possibly more vulnerable people from catching it as well. Things like that. Explain it to teachers as to why it's important for them to teach this and what their role is in spreading public health literacy. Okay, next question. Why are teachers important to public health education? So the main reason is because they have a wide scope of students. Every teacher in like a large public school can teach around up to 200 students. And so if they present that curriculum to their 200 students, then we have like an exponential growth in the public health literacy of a population. So that's the main reason as to why it's important for teachers to teach public health education. Another one is that we want to cultivate a culture where public health and epidemiology are present in schools. And the greatest players in schools are the teachers. So we want teachers to truly understand this and truly internalize it and realize why it is that they're doing this and why it's important, and then they'll go along with it and we'll have more people on board with our mission. Okay, so I saw a question. Okay, sure. I'll talk to that with my staff. Okay, now let's talk a little bit more about what you're actually going to be doing or how much we've done. So Project Unmasked has already done quite a bit of teacher outreach, but not enough. So we've got 9 teachers to teach our curriculum, which is around 800 students. And as ambassadors that you guys are, you'll reach out to the teachers that you are familiar with to ask them to help teach this curricula. And then you'll be able to tell them about, you'll just be able to tell them about all the things that I just said earlier. So for example, teachers that you may want to reach out to are biology teachers, health teachers, or any science teacher, honestly. You can even reach out to teachers that you think would be interested, but they're not like in those core subjects. Maybe even teachers of like anatomy or anything, honestly, that has any relationship to public health. You could reach out to them and ask them to teach this. So there's not really too much of a limit, but I would recommend finding teachers who at least have somewhat of a connection to public health and epidemiology. Honestly, you could even ask your math teachers. The reason being that a lot of epidemiology is covered is math-based. So for example, using the reproductive ratio to calculate herd immunity threshold, that is a math-based thing. And I think reaching out to your math teachers would also work. Okay, so this week we'll be reaching out to teachers, and next week we'll be doing meetings with teachers who agree to meet with you. So if you check the schedule on the Kid Teach Kid website for the public health advocacy program, you'll realize that we dedicate 2 weeks to teacher outreach. So this week we'll be focusing on you actually doing the heavy lifting, which is contacting teachers. And that's usually the hardest part, because sometimes you might not get a response. Other times teachers will be busy. And we really just want to make sure we reach out to as many people as possible, and you're sending out the emails and you're using language that makes sense and is convincing. And then next week is when teachers will probably have responded to you as to whether or not they'd be interested. And then you'll be conducting meetings next week during the entirety of the week, just to get them more on board with the whole program. Okay, so now let's talk a little bit more about what your tasks specifically are. So the first thing that you're going to do is to actually fill out an email template. What this email template has is I already pre-made like a skeleton of the email draft, and there are like some parts that we want you to personalize because we don't want everyone sending out the same emails to every teacher. That doesn't add any touch of personability. We want to have each student send out something that is meaningful to themselves. So maybe you can talk about why you're really invested in this cause. So for example, if you have a deep interest in public health, you can talk about that. If you're interested in just biology and health in general, you can talk about that. We really want to have each one of you make sure that the email you're sending is concise, but also convincing. So that'll just be an assignment. It's really not that hard because I already have like the skeleton for you. You just have to fill in like 2 or 3 sentences. Okay, step 2 would be to gather a list of 20 teacher emails. 20 teacher emails is a good number because a lot of them won't reply, especially if they're on summer break. So we need to have like a safety net to ensure that at least like 1 or 2 teachers may reply. Yeah. Okay, and then step 3 would be to send out the emails. And then step 4 would be to keep track of each teacher's status on the spreadsheet. And what I mean by the spreadsheet is each one of you will have your individualized spreadsheet where you'll have like all 20 of your teachers gathered there, and then all their emails, and then you'll have like another column that says sent or not sent, and then another column that says replied or did not reply. So you'll use that spreadsheet to keep track of all of your outreach. So for those of you guys who are interested in potentially later on starting like your own nonprofit or your own organization, this is a very important organizational skill that you may want to accommodate for, just to do all your outreach. So that's like a good, like, I guess a good, some good tips. And don't worry, I'll have like every person's spreadsheet already integrated into the Google Classroom. So whenever you're turning in your assignment, you'll already have like a spreadsheet to click on, and then you'll just write all your information in there. Okay, so all of this would be due before the start of class next week. Okay, so this is the email template that I made. So we can just go ahead and go through it real quick. And it says, "Dear Mr., Miss, or Mrs. Teacher last name, hope you're having an amazing summer. And then it'll just introduce yourself. So if your name is Bob and you're from Houston, Texas, and you go to like Cupcake Middle School, you'll just say, hi, I'm Bob. I'm a rising 7th grader at Cupcake Middle School in Houston, Texas." So that's like a good way to phrase that. Of course, that's not real, but you know what I mean. Okay, and then paragraph 1, you'll explain why public health education is important to be implemented in the classroom. So this is where you'll talk about misinformation, personal health responsibility, making sure students are engaged in the real world. So things like that, 2 or 3 sentences is enough. You don't want to stretch it too long. You don't want to make any email too long. Paragraph 2, which this will just copy directly. Project Unmasked is a campaign aimed towards spreading public health literacy through curricular reform. The public health lesson created by Project Unmasked has been taught to about 800 students, and many found this lesson enriching, giving them the ability to debunk misinformation and take their health more seriously. So as an ambassador for Project Unmasked, I hope to expand the scope of public health education with this lesson, and your help would be vastly beneficial in doing so. So if you notice with this paragraph, it's concise, it gets to the point, and it makes the teacher more comfortable with teaching it, knowing that it's already been taught to 800 students. So they won't think, oh, I'm the first one, I better not screw this up. Since it already has that credibility, you want to confer that essence of credibility to the teachers so that they're more likely to go along with a plan. Okay, so that's paragraph 2. This, you don't have to do anything, you'll just copy it directly. Okay, paragraph 3 is a call to action. This is very important because the teacher will get the email and they'll see what do they want me to do. So this is where you'll tell them what exactly you want them to do. So specifically, you'll ask them whether this seems like a good idea, and if so, whether they would like to hop on a call with you to discuss details further to potentially teach this. So you'll write this in 1 or 2 sentences. So again, we want to emphasize the brevity of emails, especially cold emails. Cold emails cannot be long. If you send someone a cold email and it's like 10 paragraphs or even like 5 paragraphs, they're not going to read it. That's just not going to happen. So you always want to keep emails brief. So for each paragraph, maximum 3 sentences. For this last call to action paragraph, 1 or 2 sentences would be good, because we want them to be able to skim it and see what's going on. Because a lot of the times, whether that be a job, internships, or reaching out to professors. I know a lot of you guys who are interested in science will be eventually doing that for research, like reaching out to professors, or I guess just reaching out to anyone that you're interested in. You have to learn how to best write cold emails. It's an important skill. So for example, when I was younger, I would try to ask professors if I could do research with them. And I would just write like a lot. I would write like 5 paragraphs, and then I would write down like my accomplishments, why I'm fascinated with their research and things like that. It would be really long and I wouldn't get many responses. So then I tried another tactic, which was to shorten my emails. I didn't write too much. I just wrote like 1 sentence in the first paragraph, or like a few sentences in the first paragraph. That's like, oh, hope you're doing well. I'm really interested in your research. And then second paragraph, talk about like, what my qualifications are, just a few brief sentences, don't need to list everything. And then paragraph 3 is asking them, would you be interested in, like mentoring or letting me listen into your class or things like that? That would be a good email template to use. And then I got a lot more responses using that brief email template. So this is the same thing. Because as I emphasized in the beginning, this is not a normal class, not the normal kid teach kid class. We want you to learn more about some practical skills like outreach, communications, making like tangible change in communities and things like that. So some of these important cold email tips you should definitely keep in mind. Okay, so let me just give you an example of what you can write in paragraph 1. So in paragraph 1, you can say, as you may see through the pandemic, misinformation and lack of personal health responsibility is a big problem. However, we can help fix this with public health education in the classroom. So that's a good way to do paragraph 1. And then paragraph 2, you can easily just copy it. And then paragraph 3, just say, I was wondering if you think this initiative is a great idea to promote public health literacy. If so, I would love to hop on a call with you to discuss details further and as to whether you would like to teach this potentially teach this. So that would be perfect. Gets to the point, concise and detailed. Okay. All right. And of course, at the bottom, write your name, maybe write your school, your email, and your phone number if you're comfortable with that. Okay. So next, you'll have to compile a list of emails. So this is usually like the more boring part. So first, my suggestion is to think about all the teachers you've had in the past, whether it's middle school teachers, extracurricular teachers, teachers that you know, but you didn't actually have them. Think of all the teachers that you had who were nice, or they were open-minded, or they just went above and beyond for their students. These are the types of teachers that we really want to reach out to. So usually that can be like around 5 or 6, but you still have to do 20 teachers. So you'll have to go on like your school's website or other schools' websites, preferably in your district, and find some biology or health teachers. Usually they'll have their email as there as well. So just go ahead and find a list of 20 total teachers. You don't have to know them personally. That's just, yeah. And we don't need to know exactly who they are. We just have to know that what they teach, and they have to be like at least somewhat related to public health and epidemiology. So then after you find that list of 20 teachers, you'll write their name on the spreadsheet, and then you'll find each and every one of their emails and then write it on that spreadsheet as well. Okay. So then after that, submit your list of teachers and email addresses through a spreadsheet and I will approve it. So I forgot to say this. Fill out the empty forms with your own words, submit, and I'll approve it. So basically just got to submit it through Google Classroom, and then I'll just comment or just say looks good. Usually I'll just say looks good. And then you can go ahead and do this step. And then after I look at your spreadsheet, after you submit it, then I'll just tell you looks great. And then you can just keep going with the next step, which is send them out. So for each teacher, send out the email template that you wrote. Okay, here are some very important reminders. I learned this the hard way because some of these I messed up. So step 1 is to use their correct title and their name. So if they are they're a female teacher, make sure you use Miss, because oftentimes you may not know like if they're married or not. So just say MS dot last name teacher last name. And then make sure you're using the right last name. You don't want to accidentally copy paste the email and then send it to the wrong teacher. So we don't want to do that. Okay, and then do each email one by one so you don't mess up. So before you send each email, make sure you have the right name and the right email address before you send it out. Step 3, send it out during the morning of a weekday. So you don't want to send it out on Sunday or Saturday. That's not good because teachers are not going to be checking their emails during Sundays or Saturdays. Some might, but a lot of them won't be. And we want teachers to be very cognizant and able to respond as soon as they can. So Alexandra asked, can they be elementary school teachers? Yes, they definitely can. If they are elementary school teachers, we'll probably have to tailor the curriculum so that it's more conducive and easy to learn. But yeah, they can work. Anyone that you want, honestly, as long as they're not like kindergarten teachers. We can't really do that because, yeah, kindergarten teachers, I think they're still trying to teach kids how to read. So I would say like 5th grade, 4th grade, 5th grade and above, that would work. But I would say I would prefer middle school teachers. High school teachers definitely work too. So just don't want to do like too young, because then it would be difficult for them to actually understand and do it. Great question. Okay, so then fill in the status column on the sheet. So as I said earlier, you'll have like another column on the spreadsheet that says sent or not sent. And then for each teacher that you send, you'll write in send. So what is this overall? I want to convey the message that if you're doing any sort of outreach, you want to be very organized and methodical in your approach. So you don't want to accidentally send the wrong email to the wrong person. I already said that many times. You also want to make sure that you keep track of who you sent the email to, so you don't send them 2 emails. It's really annoying when people get 2 of the same email. And that would also mean you're missing someone. So we don't want that. And sending it out in the morning of a weekday, of course, that's a great idea too. And I know it's summer, so a lot of y'all are sleeping in, but I would prefer that you send it out like in the morning, like around 7 or 8, but don't worry, you do not have to wake up specifically just to send the email. There's like this thing on Gmail called schedule send, where you can choose what time you want the email to send. So I would say choose like a time like Monday or Tuesday or whatever, any day of the week, preferably not Friday, because teachers don't really like to respond to emails on Fridays. So preferably Monday, Tuesday, Wednesday, or Thursday, and then set it to like 7 or 8 or something, so you can still sleep in. Awesome. Okay. So now let's talk a little bit more about the tracking sheet. So the tracking sheet is where you'll be keeping track of your teachers and emails. So there will be these, oh, I forgot to say, there will be the subject as well. So you'll write their name, what subject they teach, the email status, and the reply status. So make sure you're tracking them as you go along. Okay, that's pretty much it, honestly, for this class. As I said earlier, this class is not meant to be a lecture-based class. It's more for me to just provide some guidance and for you to do most of the outreach and heavy lifting. So that's actually the end of all the stuff that I have for you guys today. Do y'all have any questions? Let me check the Q&A. What is an email status? Good question. So the email status is basically just, let me go back. Email status is basically just whether you sent it or not. So for the ones that you have already sent, then you'll just write sent. For the ones that you're still you haven't sent yet, just say not sent. And another tip that I have for this is to color code. So for the ones that you sent, color code it in green, and the ones that you haven't sent, color code it in yellow or red or something. So this way you can easily tell. Okay, that's it then for most of what I had for you guys today. Please keep the questions coming if you have them, but otherwise, like, that's it. I'll send out all the important information into the Google Classroom as soon as this class is over. So that would include this PowerPoint. It would also include the email template, also the spreadsheets, and yeah, remember to do all of it before the start of class next week. Do new students coming this week have to do the last week's homework? No, you don't have to, but if you want to, that would be amazing as well. But one thing I will say though for new students is that is for you to make sure that you understand the concepts. So let me go back to the previous this. So make sure you understand the concepts. You don't have to do like a full-blown project if you don't want to, but make sure you know what symptoms are, what incubation periods are, what basic reproduction periods are, transmission, what they are, and what the herd immunity threshold means and how to calculate it. Also make sure you know what the chain of infection is, what are common ways you can prevent yourself from getting infectious diseases, and here's some good definitions. So I'll just go over it real quick since I know some of y'all are new. So the chain of infection is the spread of an infection within a community. So basically it tracks the spread of a disease, and it has 6 components: the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host. So that's like tracks like a disease's life cycle. And the case definition is what tells you how to identify people with the disease. The incubation period is the period between getting infected and getting symptoms. Basic reproduction number basically calculates, on average, how many people will a person with the disease infect in a completely unimmunized population. And then the herd immunity threshold is the percentage of people who must get vaccinated or must be immune somehow to the disease in order for herd immunity to work. And just to recap of herd immunity, it's when a healthy person has a very low chance of getting infected in a community because so many people around him or her are immunized. And finally, transmission is the way that diseases are transmitted from one person to another. So yeah, short answer is no, you don't have to. But I guess with more nuance is, even though you don't have to, you should make sure you know what these concepts are. And you can always watch the video I did last week. It's available on Kid Teach Kid and on Google Classroom, where I explain pretty much everything in detailed manners. So yeah, that's it then for this class today. Make sure you also do the Google form. It's a Google form that lets me know what your experience was doing the project. So this way I can help make the project better for future students. Yeah. So the Google form is due by the end of the day tomorrow, I believe. Yeah. So if y'all don't have any questions, that's it for me. Since it's still only like 2:30, and the next class begins at 3, I'll just like stop sharing, and then I'll just let y'all stay if you're gonna stay for the next class, which I believe is math. And for those of you guys who want to just go take a break, feel free to do so. You have around 30 minutes.